5 things your dental hygienist can do for you for an oral cancer screening. Hey, I'm Anastasia. This is Anastasia's Hump Day Happenings, and oral cancer awareness starts in April. I speak on this a lot, and my girlfriend Debbie Z speaks on it extensively. So I'll be referring to her in a few. The dental hygienist and patients. Let's go over 5 things that should be done for an oral cancer screening. Number 1, it's about the conversation. So talk about the risks. And for hygienists and for patients, this could be uncomfortable. But I have news for you. Uncomfortable conversations don't save lives. So the conversations, let's talk about the risks. We'll use the smoking umbrella. All right, so ask your patient, do you use cigarettes for smoking? E-cigs, hookahs, marijuana, or smokeless tobacco. Those are all risk factors for oral cancer. Parents, you're not exempt for this. You would be surprised at how many teenagers use e-cigs, hookahs, marijuana, and sometimes smokeless tobacco. So ask about that. Probably going to surpass it is the risk factor of HPV. HPV is a sexually transmitted disease. It is a lifestyle risk factor. Ask your adult patients, your young adult patients, have you been vaccinated? Parents, have they been vaccinated? Have the conversation why it is a risk factor. Give them the facts. And then number 4, alcohol is associated with it, but let's discuss that in future videos. Okay, so after you talk about the risk factors, number 2, your dental hygienist should look for it. Not wait for it or watch it. I'm talking look for it. It is an extraoral exam and an intraoral exam. Look for it. Look along the hairline. Look for irritations, discolorations, anything that is abnormal. And then move to number 3. Number 3 is feel for it. I'm talking take the tour to tissue. And I'm not a little drive-by of feeling and swiping it. I mean palpation, okay? Double finger it up and palpate along the neck. Palpate along the jawline. Palpate in the mouth, along the lip, under the tongue. Don't just like do a little sweep. Under the tongue, the palate. Take the tongue and give a little massage. Wrap it neatly in a gauze and move it from side to side. Because I got news for you. HPV-related oral cancers, they're in the back, Jack. Okay, so that's a fact. You've got to take your time and palpate and feel what could be abnormal. Which brings us then to number 4. Document. Your dental hygienist at the end of this can document and say, we discussed lifestyle risk factors for you. You have these, and these are associated. We'll monitor it once a year every time we do this for you. Going into number 5, patients. You get to ask dental hygienists, so when was the last time you had oral cancer training, oral cancer screening training? And dental hygienists use that knowledge. Say, you know what? We just purchased this new light or this new technology. We just got trained. And speaking of training, National Cancer Network, please amp up your oral cancer abnormality screening using this. Debbie Z provides so much information for dental professionals and for our communities in an effort to save lives. You got a question? Hashtag Ask Anastasia. Subscribe. Love to see you join me every single week. And until next time, take what you learn and make a difference with it.